All right. Good morning, everyone. Thank you for being on this very important call during your lunch hour. I hope you are eating lunch, and I hope that you will learn something. I am Secretary Janet Kelly. This is my 13th day on the job, and I've worked with many of you before, but I just want to say what an honor it is to be working on such an important issue, and certainly one that is close to my own heart. I was special advisor for children and families immediately before this role. And I come from a child welfare background. And the one thing that I know to be true that I'm sure many of you will agree with when it comes to child welfare is that it is intricately and directly linked to the welfare of that child's parents, and especially that child's mom. And so nothing has changed me like being a mom. I've got 3 kids. In fact, 21 years ago this week was my original due date. My oldest turns 21 next month. She was, of course, late, as firstborns often are. My youngest is 11. I'm still losing the baby weight from her. 11 years later, that's okay. And then I have a 13-year-old little guy that we adopted out of foster care. So I've got 3 kids, and all of the books, well, there's no manual on motherhood. All the books are true when they say that being a mom is like having your heart walk around outside your body. And it is one of the toughest jobs you'll ever love. So really honored to work on this. And I was really blessed when I was first newly pregnant with a really great community of moms. I did read a lot of books. I did listen to my doctor, but most of the information that I actually listened to was from my own set of friends and my own peer group. And I know that some moms are lucky enough to have that, and other moms just aren't. And that is why it's important to create those networks and that wraparound support through government, through the medical community, in order to make sure that every single mom is supported and has the information that she needs to be healthy so that her little baby can succeed. And not just that first pregnancy, but many more to come. We know that health is now not just physical health either, although the focus of this lunch is cardiovascular health. We know that many moms, both before and after, certainly during pregnancy, their mental health is impacted as well. And so this is a holistic effort for which I am grateful. If you're not familiar with the Governor's Right to Help Right Now behavioral health plan, please check that out, because the things that are going on in our behavioral health community will also deeply impact mothers as well. If you have not gotten a chance to see it, the governor has signed Executive Order 32, which reestablished the Task Force on Maternal Health Data and Quality Measure. And what we really want to do is find out what is a threat to moms. What are they facing when they're pregnant? How do we best address these threats? Nationally, we know that 80% of all pregnancy-related deaths are preventable. And 1/3 of those deaths are because of cardiac conditions. And I'll just tell you, I hate seeing a stat like that, but I like it in one respect because it is preventable. That means we can do something about it. If it wasn't preventable, we may not be here. We may not be having this conversation because we've tried everything and we don't know what works, but we know what works. It just requires a concerted effort with everyone on this call and people like you to develop these plans and get them out into the community. I'd like to give a special shout out to Deputy Secretary Leah Mills and Catherine Zimmerman on our team. I'm sure you've been getting lots of emails from them who are taking lead on this, as well as the commissioner at the Virginia Department of Health, Dr. Karen Shelton, and Cheryl Roberts, our fearless leader over at DMAS, who is on this call as well. And at this time, I am going to pass it over to Director Roberts to get us kicked off on our next steps as we move forward today. So thank you very much again for having me.
Thank you, Secretary Kelly. First of all, welcome. I'm going to do it fast. I'm a New Yorker, so I talk very quickly. We have 113,000 births a year in Virginia, and Medicaid does about 1/3 of them. And so we are very committed, obviously, as far as we're concerned, the investment we make into pregnant women and women who are in their postpartum period is an investment in the Commonwealth and the future of Virginia. So ironically, I'm very excited about this particular Lunch and Learn. I've been working very closely, obviously, with the Deputy Secretary Mills and the Commissioner of VDH, but this is a project that Dr. Stevens and I are doing. We actually went to a luncheon that actually changed our life in many regards. We went to a luncheon that we didn't get to sit next to each other, and we realize now that was probably destiny, because if we had, we probably would have been chitty-chatting and would have missed this effect. So we really are thrilled to do this. Let me just briefly tell you who Dr. Stevens is. She's my CMO, so that I'm tickled. She takes care of all 2 million of our Medicaid recipients. She actually graduated from medical school at VCU. She's worked she's worked all over the healthcare system, from being in the FQHC, working with the homeless, PACE, a dual plan, value-based purchasing plan, a Medicaid plan, and now here with us in DMAS. And so, Dr. Stevens, I turn it over to you.
Thank you so much, and happy lunchtime, everyone. We gave you that extra buffer so you can get your lunch and stay engaged with us. And we are so happy that you are here, so happy that we have all of our leaders here to support us and also our special guests. So we have the opportunity to introduce ourselves, but now we're going to ask you to please pull out your phones. And if you could scan the QR code on your phone, I know you have it in your hand. We want you to keep it in your hand because we would love to have your input, your thoughts throughout this program. So if you could please scan the code, answer the question of who are you? Introduce yourself and the organization that you present. And as you are doing that, we're going to talk about two special people. First, I would like to introduce you to Jasmine Brunson. So Jasmine, you can raise your hand because I know we have Hollywood Squares here. This is Jasmine. Jasmine is 32 years young. She's a native of Virginia who has 3 beautiful children, and she graduated from JMU, wanted me to get that in. But she wants us to know that shortly after giving birth to her youngest of her 3 children, she experienced 2 heart attacks. And after her second heart attack, the decision was made that she needed open heart surgery, a double bypass. But now Jasmine's here with us as a survivor. She has become an advocate and spokeswoman with the American Heart Association and also several other maternal health organizations. Love to share a fun fact because we often look at our speakers and we need to realize they're people too. So Jasmine wants us to know that you could get her to do almost anything for a Twix ice cream bar. So Jasmine, we'll keep that in mind. So that's Jasmine. And I also would like to introduce you to our second guest speaker, and that's Dr. Jacqueline Nunziato. Excuse me. Dr. Nunziato is a board-certified obstetrician gynecologist and a maternal health advocate both locally and nationally. She is the co-founder of Huddle Up Moms and started this nonprofit to bridge the needed gap between the healthcare system and the community as it relates to maternal health. Her passions include creating opportunities for quality improvement as it relates to equitable care, improvements with the 4th trimester, and incorporating and educating on trauma-informed care. She is a dedicated teacher and educator both at VTC Medical School and within the community. Now, fun fact about Dr. Nunziato. In addition to masterfully managing being a busy physician, maternal advocate, wife, and mom, she is not shy about letting folks know that she gets her coffee. And that is the way to get her jump in the morning. So you had your coffee, Dr. Nunziato? We've had several. So with that, let's see who we have joining us on this call. Wow, this is incredible. Thank you so much. We're going to keep this, and it just represents all of the awesome people who are involved with maternal care. And as our secretary said, this is a community effort. This impacts all of us. When we know that our maternal care is right, then we know that we are serving our community the best way. So I just want to share some information with you before we get started. Many of you attended that first Governor's Roundtable that we had several months ago. And so these slides were shared with us by Dr. Karen Shelton, our health commissioner. But I just want to double click on this. So the point of this slide is to make sure that we understand that every day in 2020, and we're getting more data as the years go on, but in 2020, almost 800 women died from preventable causes related to pregnancy and childbirth. When compared to other countries comparable to the US, we have a much higher rate of maternal mortality. Also wanted to point out that Virginia's statistics trend very about the same with the national statistics, and that we all have work to do. This is not only on mortality, but also on pregnancy-associated mortality. And we see a little bump in 2020, and usually we ask the crowd, what is this? But I think we all know that COVID also impacted our maternal population. When you look at our geographical area, we see that pregnancy-associated mortality by health district. And we see that certain areas of the Commonwealth have higher rates, such as in the Eastern Shore, West Piedmont, and the Allegheny region. And we also, this is no surprise, but important to note it out, that there are racial disparities in pregnancy-associated mortality. The graph on the left shows the percent of cases by racial groups. However, while the majority of pregnancy-associated mortality cases are among the white population, as depicted on the figure on the right, the burden in most recent years among the Black birthing population, who are dying at more than 2 times the rate compared with the white population. And then lastly, I want to share, I think someone alluded to this, about 31.3% of deaths occur while someone is pregnant on the day of delivery, but also 32% of deaths occur 43 days or more past the date of delivery. And this is what brings us to this topic today, is that Dr. Shelton shared with us that although substance abuse definitely is trending, we're also seeing depression and suicide increase among our maternal mortality and morbidity. We know that cardiac conditions also are prevalent. So today's discussion is about maternal cardiovascular wellness and well-being. And if this data does not move you, I think I have something that will. So I'd like to share with you Jasmine's story before we get started in our discussion. Okay, I'm going to stop that because I think I'm hearing that you're not hearing the audio. Is that correct? If someone can come off mute.
That's right.
That's right, Dr. Stevens. Well, I'm going to come back and replay that. And while we're discussing with our audience, we'll go ahead and get started, and then we'll make sure we play that video, because that is a very important part of this presentation. So let's move on and talk with Dr. Nunziato. What we didn't get to see in the video is Jasmine talked about her plight and how she didn't realize that she was having a heart condition until she called her doctor, and who rushed her in. And Jasmine, why don't we let you kind of tell the story, if you could, to help folks know while we get the video on.
Good morning. Just a high-level overview of the story was I was 2 weeks postpartum. I just had my 3rd child, and my chest was hurting. It just felt like I pulled a muscle. So I put it off. It started on Sunday. I put it off for a couple of days until Wednesday morning. I called my husband. He was like, hey, call your doctor. I called my doctor, and she was like, your chest hurt and your left arm hurts. It sounds more cardiac than you pulling a muscle. So she was like, can you please come into the hospital? So I hung up with her to lay back down and take a nap, because I'm like, she's being dramatic. I'm not going into the hospital. I just seen you 2 weeks ago when I had this kid. So I went to sleep, and she called me like 30 minutes later and was like, hello, where are you? And I was like, I'm in the bed. And she was like, no, if you do not get up right now, I'm going to send an ambulance to your house. And I'm just like, oh my gosh, she's being dramatic. So I went to the hospital. I'm there. They did an EKG, X-ray, everything. And I was just sitting there eating breastfeeding cookies, like, okay, is this over? Can we leave? And one of the doctors was like, let's test your blood for a protein called troponin. It should not be in your blood. If it's a high level, then you're having a heart attack. So I'm sitting down eating my cookies. They rush from the back and they come and get me. And I'm like, okay, what's going on? And they're like, you're having a heart attack. And I'm just like, and they're moving fast. And I'm just like, I feel fine. I don't feel like I'm in any type of excruciating pain to be having a heart attack. And it was like, you are. Your troponin level is 41,000. You've been having a heart attack for a couple of days. And I was just like, okay. So they immediately sent me back into the cath lab and put like this balloon in my chest. And that was supposed to function as my heart and give it time to heal. A day later, the pain came back, but it was like times 10. So I was like, hey, something is wrong. It was 4 o'clock in the morning. I was like, something is not right. So they came back in, gave me another EKG. They left out. They came back in with 2 cardiologists, 6 nurses, and was like, hey, you're having another heart attack. You're also going into heart failure. We have to do a double bypass. And I'm crying. I'm just like, I want to talk to my kids. Everyone's asleep, but we didn't have any of that type of time. They rushed me immediately to the OR. And next thing I knew is I woke up a day and a half later, brand new person, could not sit up on my own. I could not hold my son who I just had for 4 months. So imagine having a kid and all you can do is stare at it. So yeah, it was just going through that and not knowing that I was having a heart attack, feeling blessed that I actually survived it because everyone in the hospital was visiting me like I was I don't know, like just a miracle person, because they was like 41,000 in troponin, you're not supposed to be here at all. So that's pretty much a high overview of my story with just experiencing that and coming out on the other side.
That was awesome. I think we have it up, so we're going to play it. But thank you. I think you've got the story down pat. Yeah, Catherine, I can't hear it. I don't know if others can. Well, what do you think about when you hear that story, Dr. Nunziata? We'll continue on until we can get it.
So I've hopefully we can provide the link and then everybody can watch it later if we're not able to get it, because it really, I think, speaks, no pun intended, but to the heart of why we're all here today. I just wanted to first say thank you so much for this opportunity. I think the fact that we're all here speaking really adds volume to the fact that we need to elevate this cause and we need to work really collaboratively. And I just feel really honored and blessed to be here. And I also just wanted to say to Jasmine, it takes a special kind of person to go through something so traumatic and come out on the other side, and not just come out, but to use that to tell other people about their experiences and raise awareness. So I feel really blessed just to, be on the call with you, and just wanted to say thank you. When I talk about this very often, but whenever I hear patient stories, they're relatable because I'm an OBGYN, but before I'm an OBGYN, even though I trained for much longer, I'm a mother first. And so whenever I hear these stories, what really gets me and keeps me choked up is when you were talking about not being able to say goodbye to your children before your second surgery. Because I think that that's always a fear for any mom or any parent. And then when we talk about things that are preventable, like the things that you've gone through, or, the poor outcomes that we see, I think it just speaks volumes to, we need to act right now. We need to make some serious changes right now. And, it also really just inspires me that there is hope and opportunity for us to continue to do better and to find creative solutions for those that don't have the education, that don't have the means, that don't have some of the access, that you have. And I also am really thankful about your physician, because I think it's easy to kind of dismiss those conversations and dismiss those symptoms, like 3 cheers to that person, because people call us all the time, kind of in the middle of the night. And part of our program really hopes to educate women about how to have these conversations and what to say to kind of raise the alarm bells, because I think it's easily missed and written off as something that's a normal postpartum issue, right? Especially because women present with heart attacks that are more milder and then actually wind up being more deadly than men. So part of, system issues and things like that. But, so many thought-provoking conversations. And again, just thank you so much. I think there's a lot that needs to be done.
Absolutely. Thank you. So Jasmine, when you think about the story, we heard your story, we're going to see that. What are the key things that you want to point out that you think made the difference in you getting the care you need? If you could think of maybe the top 3 things as from a patient standpoint that really made the difference in the care that you received.
I will have to say my care team. Ms. Jacqueline just highlighted that, which is my OBGYN. She literally treats me like family, and I'm real strategic about who I choose to be a part of my care team. I don't want to just be a number. I really want them to treat me as if I was her daughter, or if I was her, or if I was someone in her family. So my care team, number one, absolutely phenomenal. The hospital and staff, like the doctor, the ER doctor, he educated me from A through Z. Like, even before we even knew I was having a heart attack, he was explaining to me while we was testing my blood. He explained to me what troponin was and how that looks as a heart attack because the EKG was okay. So definitely the care team, absolutely the hospital, and my provider. I hate to make it all about you guys, but I absolutely have to say my provider, because after that, it was such a flawless experience as far as bills getting paid, as far as them actually checking on me. It was to the point I was like, are they checking my records to see what I'm being billed for? Because they had nurses calling from the actual provider to say, hey, we see you went through this. Are you okay? They called every day, and I thought that was so amazing. So my care team, the hospital, and provider, amazing. Any fail through or any one of those, with my circumstance, I would have died. Honestly, any fall through.
So I'm going to go back. Thank you, Jasmine. I want to go back and piggyback off of that with Dr. Nunziato. This really speaks to a lot of the things that you do and the work that you do with your practice. So wanted to give an opportunity. I have on the screen, Moms Under Pressure. I love that name. If you can talk about that, and, thinking about cardiovascular risk, and what does your office do to try to empower the patient, but also the care team?
Yeah, so we created this program. Obviously, as a doctor, one of the things that I think that I have the privilege of is seeing the lens from a couple of different spaces, not only in the nonprofit world, but seeing where the system issues are with kind of my quality background, understanding the limits of our own capacity as healthcare system, and then really understanding honestly, as a new mom myself, where are the gaps here? And when we built this program, we had really 4 things that we wanted to tackle. We wanted to tackle the education piece. I feel so remiss in knowing that so many women are out there pregnant, postpartum, and don't know the warning signs related to cardiovascular disease and some of the things that can happen to them even after they deliver. There's still so much cultural stigma really focused on this beautiful, wonderful pregnancy. And there really needs to be a large shift and stigma change to, what does pregnancy really mean about some of the physiology changes, and what can that show you about your overall healthcare outcomes, and where we can take some preventative action. So education was big. Access was our second aim. We felt really strongly about empowering women by giving them actual physical tools that they can use to be able to have the conversation with their providers. I can't tell you how many women have come in before saying, I have no idea what my blood pressure is, or I don't have access to a blood pressure machine, or I don't know the warning signs. And blood pressure is just a moment in time. But the thought is that if you're tracking them and you can see a trend, and if you can differentiate between things like white coat hypertension and anxiety, all the things that do happen in pregnancy, right? And then the third was really that wraparound services, care coordination, kind of what Jasmine was speaking to. Most systems, including, my own, can really be taxed from a resource perspective, especially during COVID, and our inability to really connect in a seamless way into the community. And provide women with the things that they need. So those really tackling the social determinants of health. That's actually where we came up with the Moms Under Pressure. There are so many times where I make a recommendation as a provider and as a community person. And I know that the person doesn't have the support that they need and the resources that they need to not only put themselves first, right? but to put their health first. As a new mom, we were talking about, you're being a mother is kind of like having your heart walking outside of your body, right? And so you will always put yourself second, even though we want you to put yourself first. And so when it also comes to things like, mental health, diaper needs, food scarcity, housing, it's not a wonder why people don't take care of themselves in the way that they should. And so we really wanted to provide that wraparound service and care coordination piece that I think is missing. And so those were really our big goals. The program has grown so much over the last couple of years. It's been up and running for the last 2 years, and like all programs, the funding and the capacity building is really what elevates things and spreads the message across. So we're excited about the work and really honored at this partnership. I don't want to talk too much, but
it was wonderful. If you could tell us more about the partnership, because I like that. It's probably more than one solution, right? You picked one. It's great, it's mighty, but you're bringing in the social determinant health and all the other things that impact maternal health outcomes. But the partnership with VDH is something special. And we know that we need to see data. You talk about we want to get more funding, we want to scale this whole program. So far in your 2 years, what has the data shown? What are the outcomes so far?
Yeah, so we are measuring education. We're also looking at long-term, so transition into care. A lot of moms that I see, even just as an OBGYN, I see women while they're pregnant, and I really do then see them kind of in this perimenopausal period. What are you doing in between your mothering, right? And so what can we do during that year to get you to be informed, to understand the changes that you're going to go through postpartum, to keep you back and engaged in the system? And so I think that's part of the beautiful kind of relationship that we have with VDH. How do we optimize the services that exist and really fill in the gaps of where we don't have programs yet, or we need to kind of bring programs together? It is our hope and our mission really that not only do you come into one of our programs, but then you siphon into other programs. We have certainly had mothers from WIC, from the Medicaid office, from locally, from CHIP, come into our services, and we've siphoned them into their services, right? And so it stands to be a one-stop shop. So it's easier for women to access the care that they need. We have a number of really touching testimonials, very similar to Jasmine, of women who feel more empowered and more educated in knowing what to say to their provider, in tracking their blood pressures. We've helped to be a conduit between provider and community and patient to say this patient really needs to be seen emergently and has an issue. And we've seen a lot of wonderful outcomes in that way. And then just making people feel like they're cared for. I mean, Jasmine kind of spoke about the seamless care that she delivered. It's really been a beautiful to hear the testimony to say that, we're taking care of patients better than their own family or their own friends. And they felt so isolated the first time they gave birth. And now they feel like they have like a person that's in their corner that's advocating for them, that can, give them the help that they need. And of course, what we're also seeing is, increased compliance with medication management because they understand it better. We are hoping to see a trend we have a whole education platform about asking about aspirin, your provider. And so we really hope to increase the uptake of that recommendation.
Okay, that couldn't have happened more perfectly, because that was going to be my next question and topic. Was that, much in the literature now, and people are talking about as though it's new, but it's not that new. But ask about aspirin, this little pill that costs 1 cent can actually save lives. But a lot of folks don't know about it. I was going to start with Jasmine. Jasmine, did you, no judgment either way, which is, did you know about aspirin? I'm not sure that it would have been appropriate for your case, but did you even hear about aspirin?
No, I didn't hear about aspirin. I wasn't educated on the signs and symptoms. I think that was the biggest miss of my whole ordeal. Yes, the experience was seamless after I went through the ordeal, but before, like I didn't know any of the preventative methods, aspirin, and didn't even know what to look out for. As I've said, my heart attack started around Sunday. I didn't go for care until Wednesday. So the fact that my blood pressure was up, that you was talking about, that my blood pressure was definitely up. My feet were swollen, different things like that. But no, aspirin is my best friend now. I just want to say that. I took one this morning, but it's my best friend now. But no, I wasn't educated, and I really wish I was, because it could have been something as simple as taking it with my prenatal. Adding it to my prenatal. They need to think about that. But yeah, absolutely.
So the research has shown for our audience, there's an article that we have here, not meant for you to be able to read everything, but Catherine is putting in the chat so that you can read it on your own. It was published in JAMA that aspirin can actually prevent preeclampsia or high blood pressure associated with pregnancy, and also can decrease morbidity and mortality. It's not for everyone. They've broken it up into high-risk groups, which you can see here, people with multiple gestation, chronic hypertension, and then also moderate risk groups as well, people with obesity, family history of preeclampsia, African-American race, over 35. So it's up to that woman and her provider to come together, decide if it is right for her to be on aspirin, but it doesn't harm to ask about aspirin. So that is the word that we want to get out about that. So can you talk more about that, Dr. Nunziata, in terms of like community advocacy, from whether you're a legislator, whether you're a doctor, whether you're a patient, a pregnant person, a family member, whoever you are, you can actually help out with this whole ask about aspirin.
Yeah, so I think the best kind of laid care team is when you have the people around you that are helping you navigate the system, right? And giving you the tools that you need to start the conversations. And so I love when people come in and already know about some of the things to ask, right? Because it not only helps me as a provider who has, is at full capacity all the time, so it helps the nursing staff. It also helps you to know what to ask, right? And so part of what the recommendation came out a few years ago from this article in JAMA, and then ACOG put out which is our national organization, put out its recommendation about increasing, not only talking about aspirin, not only prescribing it, but a risk assessment. And I think that that's kind of sometimes missed in the conversation, but anybody can take it, right? So you kind of can also risk assess yourself, but looking and knowing what the criteria are, and that's something that we incorporated this year in the Moms Under Pressure program, is to understand that you may qualify, and you can certainly go and ask your provider if that joint conversation is something that may be beneficial to you. I know I took it with both my pregnancies. That's not true. I actually took it with the second pregnancy and went much longer. I had both my deliveries for preeclampsia too. And so I think, there is great data there that it could prevent growth restriction, and that it could prolong the pregnancy and decrease preterm deliveries. And the side effects and the risks are so minimal that I think most of us providers are really strongly kind of pushing this to our patients.
That's wonderful. And we have it up on the screen. If you can pull out your phones again, I bet you didn't put them down, but why not put it to good use and scan this code and let us know wherever you sit, wherever your orientation is in terms of, hey, I'm not a doctor. Why do I need to know about aspirin? Well, I'm sure you're an influencer. You know someone who you could help. So if you could just tell us, were you aware about the aspirin guideline before joining this call? For sure. We appreciate it. Also want to point out that if you have any questions, you can put them in the chat, and we're going to make sure to save time to talk about that. So while our audience is gearing up to tell us, oh, that's amazing. That, there's still some team that didn't know about the aspirin, but there a lot of folks did. And that's very helpful and good information to know. And we always want to point out, just to make sure to folks to ask about aspirin. Don't start it first without talking to your provider. So also, Dr. Nunziata, I don't know if, I think you did see the recent study that came out by the Commonwealth Fund, and it talked about kind of the state of affairs among our states and where Virginia was positioned, and some of the findings of that influence maternal mortality, morbidity. Can you talk about that study? It's hot off the press. It was July 18th. So
yeah,
that was really cool. I'm still digesting the article, but if you can kind of talk about that for us.
Yeah, I think a lot of us providers look for that report every year. We kind of sit and wait for it. So I'm on the subscriber list and have combed through it over the last week. I think what it really speaks volumes is, to me, not so much where you are in the rankings, but why the people on the top, right, have moved the needle and have influenced and changed maternal mortality, and to really dig deep into what are the programs that are being done well, that are being done successfully, and how can we adapt them to our needs here in Virginia. I think Virginia is very unique, coming, being a New Yorker myself and being very familiar with the Northeast side of Virginia. I am, understand the urban side of things, but then coming out here to a city, but is surrounded by a rural population, which means we often don't get some of that rural funding, but we do serve that population. I think we need to take the programs that are working really well and implement them and adopt them here, which is why, things like the quality improvement initiatives are huge. Why, it's, truth be told, it is one of the reasons Medicaid expansion was the reason as an OB I came down to Virginia in the first place. I knew it was happening. I was excited about it, and I really wanted to be a part of some important change. And so I think the more we can really kind of reimagine what these already successful programs look like here, we're doing the work as far as mental health. We're doing the work as far as incorporating doulas and community health workers into the care team and helping. I think the Ask About Aspirin is a great example of how your care team in the community can influence what you do on the healthcare side, because one of the things that our care coordinator does around the 16-20 week mark is to text message and ask how the enroll mom is doing, the pregnant mom is doing, and initiate that conversation. Hey, did you get to talk to your provider about baby aspirin? Are you taking it? It's part of our pre-survey, and it prompts conversation for all the people that aren't talking about it or aren't hearing about it, because it is really challenging, I think, to stay up with all of the guidelines and implementation from a system-wide perspective.
Yeah, I like how you talked about texting and your village. So what would you recommend, Jasmine, in terms of patient empowerment, community empowerment, the mom empowerment part of it too? How do folks, I would say your age group, I'm slightly older than you, I would say, but how do you guys get the word out and take care of each other nowadays?
Well, one, education, word of mouth. So we're real big on talking to each other and passing word along of, hey, like just me learning about the aspirin, you just set a fire under me, because now I got to tell 10 people, and they need to tell 10 people, and they need to tell 10 more people. So we like to talk. So education is a huge piece for us. Also, what I hate to say it, but marketing, like I have not seen anything, whether it's on your social media page, where it's something that came in the mail, whether it's something that's just at my doctor's office. They have them little bulletins and they have pamphlets that you can take, but I have not seen anything about aspirin there. So definitely some marketing materials will be helpful, especially in the doctor's office. Even on the hospital tours, when we're going on these tours, can we get a pamphlet to say, hey, think about, here's some questions you can ask your medical staff and not just the hospital. Parenting classes, I just think the education piece needs to be implemented in every area that we already have established. We don't have to, of course we can establish new things, but I think right now is we need to spread this immediately, because every time I'm in one of these sessions, I just be like, man, I wonder if I would have did this, if I took aspirin, would I've been here, would I've had a double bypass? Maybe I just would have had to have the cath, or maybe it would have just been a small heart attack that we didn't have to do anything. But truly, truly the education piece and the marketing piece for my age group, and I'm pretty sure for younger. I love the text messaging piece that you said. That I think that would be so amazing if you could text us. We do get a lot of calls as moms, so the texting is super amazing. And yeah, yes, that's what I would suggest for me personally.
I love that. And just wait and see. We listen to you. We got some great things coming up. We do have one comment / question from the audience, which I think is very important. They say that some clients want a more holistic approach and don't want to take aspirin. Are there any other options? I'll pass that
That's
to
a
you,
good
Dr.
question.
Yeah, so I think, in talking about being someone that's been really focused on the fourth trimester, like my re-envision of the fourth trimester is optimizing pregnancy. And for me, optimizing pregnancy starts with routine annual care. Like anybody that's coming to your healthcare professional, either it's a primary care physician or OBGYN provider, needs to talk about your risk if you're thinking about getting pregnant. What medications are you on? What is your family history? What are the things that you can do to optimize, before you get pregnant? And what will that look like when you get pregnant? I think that risk assessment is so crucial and missed so often, is that when we're talking about this holistic approach, the more upstream that you can be, that's like my public health, but brain is set, but the more upstream that you can be, the more you have the ability to be low intervention, right? It is, I think, everybody's hope and vision and dream that we, decrease the primary C-section rate, that we decrease the maternal mortality and cardiovascular risk. And some of that conversation needs to happen much sooner than the initial prenatal visit, right? It needs to happen much sooner than the postpartum visit. And I do think we have the opportunity to do that. When I hear from patients, I often hear when I'm in the weeds of it, my mother had this and my sister had this. And, I also, had this random hospitalization one time. And it really speaks volumes to the fact that we just need to be a lot more upstream from those conversations, right? Because diet changes, nutrition, exercise, weight loss, controlling other medical conditions like diabetes and things like that can lower your risk of needing an intervention at all in general.
Right. And, I thank the audience participant for putting that question in there, because we really need to meet people where they are. Okay, so let's say someone says, I don't want to use aspirin. Okay, well, let's talk about that and praise them for speaking up on their beliefs and continue to educate, because a lot of folks, we talk about, they don't come to the doctor, people won't listen. Well, they want to understand and they want to build trust. So there's another question here. They say, is there an ideal time to start a low dose aspirin?
Before 16 weeks is ideal. You start it at 12 weeks. You can start it. It has shown benefit up to 28 weeks. Even if a patient, some people come into care late because of access issues, and there is a benefit in starting it regardless. It's just not as high. But ideally before 16 weeks is the optimal benefit that we see to prevent preeclampsia and preterm deliveries.
Great. So ask about aspirin. It's like, I like what you said, Jasmine. Okay, now that I know, I have to tell 10 people. So we're going to challenge the
wrote that down too.
Okay, I don't know. Our number was 106.
Each one teach one. Each one teach one.
So how about this? If all 106 of us tell 10 people today, wow. Yep. What is that? And then we can take a challenge. Maybe take a day off and try again tomorrow. 10 more people. We can do this. So Genie in a bottle. I always like to ask people when I talk to them and I hear such interesting stories and facts. Genie in a bottle, Jasmine, when it comes to maternal health and outcome, what would be the one thing you'd wish for?
Oh, I'm so glad you asked this. The one thing is Genie in a bottle, I can bet, waved by Harry Potter wand. I will really ask if we as moms can be, if our care can be more attentive, meaning one of the statistics you said at our last panel that I was on you is that maternal mortality is up until the child's first birthday. So when a child is born to their first birthday, it's that window of something can go wrong with the mom. I really would love if we can get more doctor's appointments in. We only get 1 6-week appointment. So for instance, my son, when I had him, he had a 2-week. I seen him when we got out of the hospital. He had a 3-day appointment, the 2-week, the 1 month, the 4 month. It was consistent. And the thing that always resonates with me is we are seen once, and I have a whole year that I could potentially have a cardiovascular event, any of those things. So I really, if I could ask for anything, can we please get the same care and attention that we're giving to this newborn that I would like to see my OBGYN in 2 weeks, because do you know what? If I would have seen her at 2 weeks, my son 2-week appointment was Friday. My heart attack started on Sunday. Do you know if I had my appointment on Monday, she would have knew. She would have knew. Like, so I really, if I could ask for anything, can we please get more appointments than just a 6-week appointment? Can we get a 2-week? Maybe we don't have to get all 10 that they receive, but one is not enough. One is absolutely not enough.
Shout out to Medicaid. I'm, no bias, but the extension of postpartum up until a year after the birth, that's amazing. There are also programs, telemedicine, if you can't get in. There's the care team, the 4th trimester doula programs that people have. So there's a lot out there, but I think we need to get the word out is what I'm hearing, and then fill in any gaps. So passing on that genie in a bottle to you, Dr. Nunziata, I bet you have a lot, but if you had to pick one, what would be the one thing you'd wish for?
I'll echo what Jasmine said. I think it's both a cultural shift, right? This stigma of this perfect pregnancy that I'm constantly battling, and talking about, what happens after, that
Yes.
I always think, as a preeclamptic OBGYN mom with a baby in the NICU, I can remember feeling so isolated and alone.
Yes.
I have financial means. I have all the things I should need, and I still found it so incredibly challenging that I think that if we could give that much care in the postpartum period, that would probably be my utopia of
yes.
True. So this was just the beginning of many conversations, and I just want to thank everyone in our audience for participating, for not only just showing up, but also signing in, using your cell phone, and sending in your questions. So things happen for a reason. We couldn't get the video on before, but I think this is a great way to round off, followed by we'll have some messaging from our leaders about what's next with this. But thank you both. Kudos. And I know, guys, you got to learn how to use that there's a little meme in there that says clap. You can clap reactions. So send the claps and the shouts and everything out on your thank you. Awesome job. Great energy. Everyone is loving it. So for that, we will play that video.
We as women, we think that we're so in tune with our bodies that it's like, hey, I know when I'm pushing my limit. I know when I need to reset and digress. But this was the first time ever in my life that I didn't recognize the signs that something was horribly wrong. So it scared me. It made me rethink life. My name is Jasmine, born and raised in Richmond. Went to college here, went to JMU. Met my husband here. He's my high school sweetheart. The new baby. His birth was easy. It was super smooth. Like, he literally came out so fast. I was so happy. First couple of weeks, I felt fine, but my feet kept swelling. And I just thought it was like, postpartum issues. After that, it was like, okay, something may not be right, because the next day I had pain in my chest. So I called my doctor, and she was like, yeah, it doesn't sound like you pulled the muscle because you said it's radiating down your left arm. It sounds more cardiac. And she was like, get up right now or I'm going to call the ambulance. And I was like, Lord, she's being so dramatic. So dramatic. Got a CAT scan. I got an EKG. I got an x-ray. So the doctor comes back and I'm like, can I leave? Can I go? He was like, you're having a heart attack. And I'm like, immediately I start crying. And he was like, you've been having it for a couple of days. How come I didn't know that this was a heart attack? The main question I asked, so what if I didn't come in here today? He was like, you were going to die. Later on this afternoon, you would have died. We need to insert a balloon through your groin into your chest, and this balloon is going to function as if your heart was going to function. The procedure was simple. About midnight, Thursday night, the pain that I had came back, but it was times 10. And I knew something was wrong. So I reached out to the nurses. I was like, hey, the pain came back and my arm is radiating again. So something isn't right. But they said, I need you to not panic. you're having another heart attack. And I immediately started crying again. I'm like, I thought you said the balloon was going to fix me and we were okay. And he was like, you're having heart failure too. He was like, we need to take you to the OR and we need to do a double bypass surgery. And I was like, is that open heart surgery? And he was like, yes. And I was like, can I call my husband? He was like, no, we've already called him. He already gave us the approval. We just need your confirmation. But it was the medical disclosure that really had me scared. It was 4 o'clock in the morning, so my kids were asleep. And I think that was the most scariest thing for me, because if I didn't come back, I didn't even get to talk to my kids. I didn't even get to tell my husband I love him again. I'm used to being strong, if that makes sense. I'm a mom. I still ask myself, why did I make it? Like, why am I here? What is my new purpose? Everything that once was normal to me and came natural was completely brand new. So I couldn't lift my baby up. I feel like I was, failing as a mom because I couldn't do my normal motherly duties. I feel like hopeless and helpless because I'm used to taking care of people. So this is the first time in my life I had to rely on others. I was one of the youngest people in rehab. Being at cardiac rehab made me feel like I was home, because it was like, no matter what I said there, they understood. They always say I was their little cheerleader at therapy, because I go in there and I'm so excited, like, hey, how everyone is doing today? We gonna make it through this hour. So maybe my purpose is to go through that and help others get through that. Be a light in someone else's light, even when I can't shine as bright within myself. Even though I was motivating, my teammates around me, they motivated me to keep going and give myself grace and to also be proud of myself. They taught me how to be proud of the small things and to celebrate those things. I'm so grateful and so thankful to even be a part of this association. A lot of this is me trying to figure out my purpose. You will reaffirm what my purpose is, because I didn't know that going through this, that I would be in a position that my story would actually affect other people. I knew my purpose was to be a mom. I always wanted to be a mom. Purpose. That's my word of the next 48 years, is purpose. Today, the woman looking back at me is humble. She's grateful. She's terrified. She's a fighter. She's overly loved.
Thank you so much, Jasmine, for sharing your story. Thank you for everyone. And there's been people are putting stuff in the chat, saying how courageous. We thank you. And we're gonna text our 10 people today. So I'm good with that. I'll turn it over to Leah Mills to close us out.
Okay. Thank you so much, Dr. Stevens. I'm going to channel Director Roberts. I am not from New York. I'm going to talk fast and pretend that I am, but I get the best part. I get to handle the best part, I think, other than hearing from you all. I get to handle the thank yous. And first of all, I really want to thank Jasmine. Thank you so much for telling us your story. From me, and I think I would echo everyone on this call today, just taking your story to use it to educate us, really to spread the word, to help others. We really are very, very grateful. It means a lot. So from the bottom of my heart, from our secretary and from everyone, thank you so much. Really very, very grateful. Also want to thank Dr. Nunziato for being here. It was so very appreciative. Thank you, everyone. Like clap emojis, like Dr. Stevens said. Thank you so much for helping, sharing your subject matter expertise. And of course, Dr. Stevens, you are the best facilitator. Just so grateful to have you here today. Just really helping to tie everything together as always. I want to also thank Catherine Zimmerman, our Assistant Secretary, who also pulled all this together. Catherine, you are the best. Cheryl Roberts, Director Roberts, and Dr. Shelton for your wonderful slides. Thank you so much for letting us use your slides. They are just spectacular. They really helped set the table for us today, and our IT folks. So, of course, we had a couple little IT issues today, but I think we got it worked out. And I think it worked out because we got to close with Jasmine's amazing story. So I think you all know that maternal health is a priority for us. Governor Youngkin and Secretary have made it clear that we want to hear from the community members across the Commonwealth, and we need to. This is going to help inform our effort, and it's a critical partnership for us. And we have to use, which I think many of you all from the call have been with us when we had our roundtable in February. We had another lunch and learn back May 29th. And then Dr. Stevens, this one today has helped us pull together. We have to use data, but we also have to listen. We have to listen to our mothers and everyone across the Commonwealth to have opportunities to make changes that we need to make. So just some other housekeeping items. Please check out our website on HHR under initiatives. We finally have the recording up. Thank you, Catherine and everyone, from our last Lunch and Learn. We're going to be posting the recording for this Lunch and Learn. We're going to keep building on all of our past efforts. We are going to be, let's see, I understand that DMAS has an exciting announcement that they're going to be announcing August 12th. Regarding maternal cardiovascular health. They're going to have a reveal. Go to the DMAS site. I don't know if anyone wants to chime in very quickly, Dr. Stevens or Director Roberts, if they're on, or just maybe just stay tuned and go to the DMAS website. Is that good? Okay. Please stay tuned. Other quick announcements. We are going to be holding a roundtable discussion in Roanoke, so we can keep hearing from folks. We just want to keep this good effort, and it's going to be in August, and we really are going to keep focusing on, as I said, having some action steps to help us inform our efforts and hearing from more of a rural perspective, and we will be providing additional information about that. Lastly, as Secretary Kelly noted, Dr. Shelton is going to be convening the Maternal Data Task Force. We will be sharing that information too. More information will be forthcoming on that. It will be posted. We will be providing that with you all. We are hopeful that the first meeting of the task force will be sometime in August. And again, more information will be forthcoming. Any meeting that we have will be open to the public and live stream, just to let you all know. Everything is still being assembled on that front. So again, more information to follow. But just wanted to thank you all for spending your lunch hour with us. And thank you for our conveners. And that is it for me.